Manual ventilation performance by EMS responders. Summary. Manual ventilation is a basic skill that every emergency medical services EMS responder is expected to perform proficiently. Improper manual ventilation may result in significant morbidity. However, there is no feedback mechanism or method of control for the volume, pressure, or frequency during manual ventilation. In this study, we aim to quantify the ventilation parameters of manually delivered breaths using a simulated lung. 199 volunteer EMS responders from the EMS World Expo 2019 and EMS Today 2020 participated in this study. Volunteers manually ventilated a simulated lung using a manual resuscitator bag for 18 breaths. Descriptive statistics were computed for peak pressure and tidal volume, and a multivariable linear regression was conducted to determine whether there was an independent correlation between peak pressure or tidal volume and 7 different variables: sex, using 1 versus 2 hands, hand length, hand width, self-confidence rating, frequency of manual resuscitator use per month, and years of experience. Both peak pressure and tidal volume delivered by EMS responders had a high level of variability. 83% of providers delivered at least one breath exceeding the recommended safety threshold of 22 centimeters of H2O peak pressure or 560 milliliters of tidal volume. In addition, 98% of first responders delivered at least one breath that was inadequate or excessive. Peak pressure and tidal volume were significantly higher in those using two-hand manual ventilation. Our study demonstrated large variability of tidal volume and peak pressure within and, to a lesser degree, between providers. Our results showed no likely clinical significant role of gender, hand size, frequency of use, or years of experience in determining peak pressure or tidal volume. Out of the 7 variables that might have affected tidal volume or peak pressure, only the use of 2 hands versus 1 hand had a potentially clinically significant effect. Our study identifies a clear need for evolving the manual resuscitator in order to ensure every provider can consistently deliver breaths at appropriate volumes and safe pressures.